Hi guys, my name is Jessica, and this is my flashcard presentation on osteoarthritis. So we're going to start with the disease process. Osteoarthritis is characterized as a joint disorder and has been identified as the most common chronic articular disease with an increasing prevalence due to the population, aging, and obesity. Osteoarthritis is characterized by articular cartilage degeneration and persistent pain, causing disability, loss of function, decreased quality of life, and economic burden. Due to the impact of this disorder, it can drastically decrease the activity of an individual diagnosed with osteoarthritis unless treatment and rehabilitation are initiated. Van Meter and Huber discuss the two different forms of OA and that there is the primary form, which is correlated to obesity and aging, while the secondary form correlates to injury and abuse. We're going to move on to pathophysiology of osteoarthritis. As osteoarthritis affects the joints within the human body, we first must discuss the makeup of the joint. The diarthrodial joint connects two adjacent bones covered with a special articular cartilage layer and wrapped in a synovial bursa. The articular cartilage of weight-bearing joints in particular, an example would be the hips and the knees, is damaged and lost through structural fissures and erosion resulting from excessive mechanical stress or breaks down for unknown reason. Articular cartilage covers the ends of bones in the diarthrodial joint and absorbs shock from joint movement. Because of the absence of vessels within cartilage, chondrocytes can live in a hypoxic environment. Now, these chondrocytes are important because the initial stages of OA are characterized by increased compensatory mechanisms, such as chondrocyte hypertrophy and proliferation, increased matrix synthesis, and subchondral bone remodeling. Following the breakdown of the articular cartilage, eventually the subchondral bone may be exposed and damaged, and cysts and osteophytes or new bone spurs develop around the margin of the bone. Over time, pieces of the osteophytes and cartilage break off into the synovial cavity, causing further irritation, leading to a narrower joint space. This right here is a wonderful picture of the progression of OA on the left side. So you have the normal joint in the middle, and then you have the progression of osteoarthritis on the left side. The right side is the progression of rheumatoid arthritis, which is a completely different type of arthritis. So we're going to be focusing on the left-hand side and the middle. So the normal joint, you have the synovial fluid, the cartilage, the bone, the synovial membrane, and the joint capsule. However, the progression of osteoarthritis, due to aging and mechanical load, you have cartilage degeneration that moves on to cartilage wear and tear that may or may not produce mild inflammation. Then you further injure to joint space narrowing, bone spurs with the osteophytes, and then as you move down, joint structure destruction, severe pain, and joint failure. Now, this is like severe osteoarthritis. So you're moving through stages as you progress through osteoarthritis. And then down here you have, so you can kind of compare, this is the normal joint space, and then this is the broken down joint space where you can see right in here, there's a very big narrowing compared to this open space up here. So this red part on the side is the mild inflammation that you may get from osteoarthritis. Not everyone does. And then right in here, the little blue space is the cartilage degeneration and wear out. And then this points, this arrow right here points to the subchondral bone sclerosis, which as you can see, it's kind of jagged and looks kind of sharp on the edges. And then, like I said, there's joint space narrowing right through the middle. And then up here, you can see that there's a bone spurs where the osteophytes may be. And then down here, there's some information, treatment purpose, joint regeneration. The major route would be interarticular, inject, and implant. So sometimes they try and replace the joint space by injecting a compound that would possibly replace the cartilage that you've lost. And then proven efficacy, pain reduction, and partial recovery of the injured cartilage. Now we're going to move on to risk factors. So according to the research, there are a few main risk factors that lead to the development of osteoarthritis. The risk factors for OA can be divided into individual susceptibility features, increasing age, obesity, female sex, joint biomechanics, genetic factors, and factors that alter the biomechanical stability of joints. So injury, repetitive joint use through occupation or leisure, and joint malalignment. The individual risk factors place a person at risk due to genetic relatability and maintenance of the individual health of the whole patient. In contrast, the factors that alter the biomechanical stability of joints are caused by impact and movement on the joint itself. We are further going on to the major signs and symptoms and how they are occurring. The most prominent sign and symptom of osteoarthritis is pain, as described through the text as often mild and insidious initially, is an aching that occurs with weight bearing and movement. Then the pain becomes more severe as the degenerative process advances, and the pain may be unilateral in some cases, depending on if you've overused like both of your ankle joints or both of your knee joints through sports. This pain occurs due to the movement and irritation of the narrow joint space and the broken off pieces of cartilage and bone fragments irritating the lining of the joint. Further signs and symptoms include difficulty walking, difficulty chewing, depending on if the TMJ joint is involved, which is your joint right in the jaw, Herberdin nodes, which are bony enlargement of the distal interphalangeal joints in the hands. Crepitus may be heard as the irregular cartilage grates together. Also noted throughout the research is that this is not a systemic disorder, so there are no systemic signs or changes in serum levels as well. Diagnostic tests, so we're going to move on to those. As there are multiple different types of arthritis, as we looked at the picture, there was also rheumatoid arthritis, but it's very different. So diagnosing osteoarthritis can sometimes be challenging. However, the main diagnostic tests seen throughout the literature are X-ray as well as MRI. As stated above, there are no changes in serum levels to be used as diagnostic criteria. However, one study presents the use of the Kellgren-Lawrence scale, Albach classification, and COGS. These scales are to be used in relation after viewing radiographic images to identify the severity of osteoarthritis if present. And then these are my references down here, and I hope you enjoyed this presentation.